3, 2, 1. We're live. Okay. Hello, it's Bill, the Knee Pain Guru. Today is Monday, June 8th, 2020. Hope everybody is doing well, staying safe. Today, we are going to talk about the top 10 reasons why physical therapy might not help your knee pain. So we're going to get into that in just a second. If you have a question, please enter that in the comments section over on the side. I will answer those questions after this short live presentation. Do know that I use your questions and comments and the topics that come across as a theme for what's going on with your knees for future videos. And we do these videos a couple times a week on these various topics. So make sure you put in your questions over in the comments section. Let's see. Make sure to give the video a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel, as well as turn on notifications for future videos as we do these twice a week. Okay. Now we're going to get into the top 10 reasons why physical therapy might not be helping your knee pain. So the first reason: does your knee feel better after physical therapy? 9 times out of 10, clients that I work with after going to physical therapy, their knees in more pain. And if the shortest distance between 2 points is a straight line, and you're trying to get your knee out of pain, putting your knee in pain is not going to get your knee out of pain. That's kind of a gimme. That's a softball. And lobbed it right over the home plate. Okay. Second one. Do you need to take drugs to make it through the pain you feel during a physical therapy appointment? I actually had a gentleman I was talking to that he had the time taking the prescription drugs, so they would kick in when the physical therapy appointment would begin because it put his knee into so much pain. If that's what's happening for you, then there's a good chance physical therapy might not be helping with your knee pain. Number 3, are your knees less painful the stronger they get? I work with professional and Olympic level athletes, and a lot of them are incredibly strong. They have strong legs. They can squat 300, 400 pounds and do the whole stack for leg extensions and leg curls. And they still have pain. So is it really a function of strengthening the legs? So if you're going to physical therapy just to make your legs stronger, to get your knee out of pain, you might be shooting in the wrong direction. Okay. Do you have less scar tissue since you've been going to physical therapy? Because scar tissue is like your body's Band-Aid. It protects the knee from getting injured further. So if you're trying to break down scar tissue and you're pushing through the pain, you're pushing through the range of motion, or the physical therapist is forcing that range of motion and is causing your knee more pain, and the scar tissue isn't breaking down, there's a good chance physical therapy might not be helping with your knee pain. Number 4, after months of physical therapy, has your range of motion gotten where you want it to be? A lot of people say no. A lot of clients that I've worked with say no, because the pain that you experience when you push the knee past a comfortable range of motion causes your knee to tense up more, which means it's saying, I don't want to do that. I don't want to go there. So if you're forcing the knee, you've been going to months of physical therapy and the range of motion hasn't increased, then there's a good chance physical therapy might not be helping with your knee pain. Does your number 5. Does your physical therapist tell you to stop guarding? Let the knee go when the knee's in pain, as they're trying to force your knee into a range of motion that hurts. If they are, then there's a good chance physical therapy might not be helping with your knee pain. And even better, number 6, can the physical therapist tell you how to stop guarding your knee? It isn't just like a light switch you could turn on that you will stop protecting the knee because the knee's in pain. There's layers. There's other stuff going on. So if your physical therapist can't tell you how to stop guarding or the process by which you develop the skills, so the knee doesn't guard on it when it's forced into a increased range of motion, there's a good chance physical therapy might not be helping with your knee pain. Has your physical therapist given you something different that evolves, shifts, and changes to address why your knee hurts? Or are you going through the same routine every session? Leg extensions, leg curls, leg raises. And it's not changing. They're doing the same routine every time you go in there. And your knee's not improving. So you're doing the same routine, your knee's not improving, and the protocol isn't changing with what's going on. Then there's a good chance physical therapy might not be helping with your knee pain. Are you surprised at the new innovations your physical therapist comes up with since your last appointment? Meaning, are they coming at it from a different angle? Maybe your mindset, maybe how the emotions play a role in what's going on with your knee. Maybe other factors like diet or hydration or supplementation. And if they're not, and you're still not getting any improvement, or the improvement is only minimal, but you got to work really hard just to keep that minimal improvement, then there's a good chance physical therapy might not be helping with your knee pain. And the last one. After all the time you've been going to physical therapy, can your physical therapist tell you why your knee hurts? That's it. Okay, we got questions. Go into over here. Let's see. What about dry needling? What about it? There's D. Up, oop. Is that what that is? Or maybe it's yep. D. Fritz, what about dry needling? Have you tried it? I personally never tried dry needling. And so I can't speak from experience about dry needling. The quickest and fastest way I've seen for a knee in pain, or you have limited range of motion in a knee, is to begin changing the neurological signaling in the knee that's causing the nerves to be squeezed, causing the pain. That's the fastest way. And by changing the neurological signaling, the joint relaxes, the pressure gets off of the nerves, and relief is experienced. Because we're working directly with the reflexes, the nervous system reflexes. Just like when the doctor taps your knee with a hammer and your knee jumps, those reflexes engage when we put the knee in a position of comfort, which engages those reflexes in a way to change the neurological signaling and cause relief to happen in the knee. Okay. Does it work? If you've tried it, you tell me. Okay, keep getting a super tight knot in my calf, can't release it manually. And the reason why you can't release it manually is because the addressing of the tension in the knee or in the calf is on like a superficial level. It's like picking a weed but not getting the root. When you change the neurological signaling, you change the root. We're changing the source of the pain, which allows the body to let go of the tension on its own. And it's through getting in alignment with the neurological reflexes, the reflexes that happen all the time, every day. Like we experience these reflexes on an unconscious level. Like if someone throws a tennis ball and it's coming straight at your face, and you just look and you immediately reflexively bring your hand to protect your face. You go to you trip on something, you slip and fall on the ice, the body immediately tenses up to protect itself. You stub your toe, the tension goes in another area of the body. These are the reflexes that are engaging all day, every day, throughout our life. And what happens is these are tensing up on an unconscious level. So you have knee pain. The tension or the pain happens in the knee because of the squeezing of the nerves. And it reverberates out like a spider web through the rest of the body, through the nervous system, to tense up the calf, the hips, the lower back. It increases the tension in the body, which makes it more difficult to stretch out, more difficult to move. You feel older, you feel achy, like all of this stuff happens not necessarily because you're doing anything wrong. It's because there isn't a deep enough understanding of these neurological reflexes as to what's happening to increase the tension and what can we do to decrease the tension to get the pressure off of the nerves and get your body relief. Okay, D says knee hurts going downhill, but not up. So here's a question. Why? Do you understand why? And if you don't understand why, then it's important to look at the tension in the body. There's a certain tension pattern that the knee has when you're going uphill that doesn't exist when you're going downhill. Make sense? Like we have a different tension pattern when we lie down than when we sit, than when we stand, than when we walk. And when we walk on flat surfaces, it's a different tension pattern than when we walk on an incline up or an incline down. These are all different tension patterns in the physical body. And this is part, it's like a vice. It gets cranked every day and it gets a little bit tighter and a little bit tighter and a little bit tighter. This is the tension and stress from life, injuries, accidents, traumas, surgeries. Natural process of being human. What it doesn't come with is the manual as to how to let go of this tension pattern so the body relaxes and lets go of tension so you don't have knee pain going downhill. Is this making sense? Questions, comments, nasty remarks? It doesn't matter. These are universal principles. And you cannot argue with universal principles like gravity works, water flows downhill, every action has an equal and opposite reaction, whether we're aware of it or not. Everything that I'm saying can be backed up by universal principles. So it's independent of your belief. And if you don't understand something or it's not making sense, ask a question, and I can break it down into a manner where it does make sense so you can start getting some help. Okay, so then why oh, here, I'll put this up here. So then why if knee starts to feel better and I'm not thinking about it, then I go to work out, it hurts again? Because your awareness of the tension patterns that are going on in your body aren't there until you work out. It's kind of like that car. that only shakes driving 47 miles per hour. 46 miles per hour, it's okay. 48 miles per hour, it's okay. The moment you get to 47 miles per hour, the tension of what's going on with the oil going through the system and the gas and the tires and whatever else is going on in the car causes the car to shake. So you have this pattern that is going on in your knee, D, that only engages when you're going downhill and when you go to work out. You start releasing these tension patterns, and then the pain won't be there at all, ever, whenever you do stuff. Yes, but I don't know how to fix it. Glad you asked. You can head on over to thekneepainguru.com. I have a video there that goes over, begins educating you on this process. And it get on the list, the newsletter list, as well as, and if you want to take action today, because today is Monday, June 8th, we have a call. It's a group coaching call that I offer for clients who wish to join. It's called Knee Club. Knee Club, we meet twice a week in a private coaching program. You get access to the videos that I would point you to. There's specific ones for the calf and for the knee joint that I'd have you start with. And then it would be interesting to learn more about where in the knee it hurts when you're walking downhill and where in the knee it bothers you when you go to the gym. Like what exercises you're doing, what positions you're in, how long does the pain last after you leave the gym? What do you do after leaving the gym that the pain starts to come down, that disappears when you stop thinking about it? So digging into those aspects of what's going on in your knee is going to be helpful in understanding which modules in the members area of Knee Club that I would give you in order to address that. Is that making sense? Yes, no, maybe. So that's your strategy. Head on over to the kneepainguru.com. Watch the short video, follow its instructions, get into Knee Club. Ooh, tears. Wait, Miriam. What does it say? Hey, Miriam, had meniscus years on both knees. Meniscus tears. Oh, that's spell check. They swell when I sit and climbing stairs. It's a nightmare. Help. Yeah, sure, Miriam. Ooh, tears. Yeah, we don't want you crying. There's plenty of stuff to cry about in the world today. Let's not make it about the knees. Okay, so this is a perfect example, Miriam. You had knee surgery. You had meniscus tears. So, what happened? Okay, Miriam, let me ask you this. Have you gotten surgery to repair the meniscus tears? That would be a good one. So let me know if you've had surgery on that. And then there's, like, if something is broken or torn in the knee, torn like a meniscus tear, if a meniscus tear exists, then the pain could be caused by the tear in the meniscus. There's going to be a different strategy than if you've had a meniscus tear, you've gotten it repaired, and you're just dealing with the pain. So it's two different strategies. If it is torn then, and you didn't get surgery, then we would have to look at the location of the tear, the direction of the tear, the degree of the tear, meaning how big is it, and then that can give us a different strategy in order to address it. So there's a couple different. Miriam, you had, okay, so your You had these meniscus tears, they were repaired, or they trimmed it up or whatever they needed to do, and you still have pain. And this is quite common. So this goes back to the understanding that when the knee feels pain from a trauma, accident, injury, surgery, something like that, what ends up happening is the body tenses up to protect itself. It squeezes on the nerves. It's giving you the experience of the pain. We need to change the neurological signaling. This is the whole point of this video, was to emphasize that going to physical therapy and pushing through this pain or trying to strengthen your legs from this place that you're at U and D, strengthening this place from where you're at just reinforces the tension pattern that is causing your knee to hurt to begin with. By changing the neurological signaling, which is the tension pattern that is going on in the knee, the hips, the lower back, the ankles, the feet, hamstrings, quads, all of that, this bigger pattern that is going on in your body that leads to the knee to hurt. So we start creating comfort in the knee, which brings the pain level in the knee down. And then you become more aware of these tension patterns that are going on in other parts of your body, hips, lower back, all those other places. And then what happens is you're going to try these things. You're going to have an experience on the other side of it, a noticing, an awareness of how the pain is different, how the pain has changed or moved, whatever happens. And then we need to look at, well, did the pain come back? When did the pain come back? Did you have an awareness of the pain move in another part of your knee? Or maybe it moved down your leg or up your leg, or maybe you noticed in your hips and lower back. All of this gives me a picture in my mind on how we need to move to a different video module to give you relief as to how to relax the tension. And it's all about comfort. We stop focusing on the pain. We start focusing on comfort, where the pain is not. Unfortunately, our nervous systems aren't hardwired to look where the pain is not. We look where the pain is. And this program is teaching you how to look at where the pain is not. Is that making sense there, Miriam? And the goal is that as we reduce the pain in your knee, you gain more awareness and a deeper understanding of what's going on in your knee and the rest of your body, and give you the tools so eventually you won't need to work with me anymore. It'll be at a place where it's like you got the things that you need to do to take care of yourself. And there's members or clients that I work with that they go on to other things. Like I got a 70-year-old soccer referee that we're working on all sorts of cool stuff to relax the tension in the rest of the body so he feels younger and younger and younger. So that's kind of how we do it. Okay, let's see. D. Okay. Lateral kneecap. Lunges, jumps, hurts all the time. Let's see. Why? It goes back to the same thing that I said before. Tension patterns, nerve irritation, tension pattern that's going on in your, let's see, in your kneecap. Looks like with lunges, you're going to be affecting the hips and the lower back. Jumps, is it when you push off or when you land? I'd need to know more on that. But these are different tension patterns. So what we focus on in the program is applying principles to the body. And once we address those principles, you'll notice that what's going on in the kneecap, and when you do lunges and when you do jumps and when it hurts all the time, you're going to notice these patterns. These patterns, like you say it hurts all the time, then you said it doesn't hurt unless you go to the gym or go down an incline. So we have to get in alignment with what's really going on in the knee be honest with ourselves in order to address and change these patterns that exist. And when we have pain, there's a disconnect between what we would like to do and what the knee is actually capable of. And once we start creating comfort in the knee, we start lining this up to become aware of what we're capable of doing and what the knee is capable of, or what we want to do and what the knee is capable of. Okay. Yeah, you're welcome, Miss Miriam, Health and Creativity. It's a simple process. That doesn't necessarily mean it's easy. It's going to challenge you. The program will challenge you as to, like anything else, you got to show up, you got to participate, you got to do the homework, you got to test and tweak and adjust. And in doing so, what happens is you see results. And based on those results, we modify the program to customize what's going on with your knee, whether it be a meniscus surgery issue. It hurts more when I do those other things, so pain is, I guess, tolerable until I do those other things. Yeah, and this is what happens. It's kind of like the frog in the water. You ever like boiling a frog? If you have a pot of hot water and you put a frog in there, the frog will jump out of the water. But if you put the frog in a cold pot of water and turn up the heat gradually, the frog will cook in the pot. It's the same thing when we have pain. The body has to adjust to its experience of pain. So when you first injure your knee, what happens is the body will slow down the process to integrate how much of the pain you can experience at once. And if we have too much change in a short period of time, the body goes into shock. It doesn't know how to integrate, like in a car accident. You bam, and all of a sudden, everything in your life changes in a very short period of time. When it does that, the body needs to slow down. You'll get like disoriented. You'll be disconnected from the experience. You may have difficulty breathing. You may need to lie down. It'll drop, your temperature will get all wonky. And that's to help your body integrate all of the change that took place in the car accident so you don't die. And the same thing with knee pain or a knee surgery. We have two people with meniscus repairs. When we have a knee surgery like that, knee pain, torn the meniscus, knee surgery, those are traumas that the body experiences. And the body normally tenses up to protect itself from the experience of the tear and of the surgery, the stress leading up to the surgery. You're going to be unconscious for a period of time, the anesthesia wearing off. What's my knee going to be like afterwards? All of this is trauma that your body's trying to process. So we disconnect from that experience. The brain disconnects from that experience so we don't die. That's normal, natural response. So what ends up happening is we have this idea that, now I had it too. I dislocated my left knee 4 times, had reconstructive surgery on the ligament in my left knee. They took out 2 pieces of meniscus. And I had this idea after talking with Dr. Ellis that I'm just going to jump back out on the judo mat and do things like I did before. I'm going to fix what was mechanically wrong in my knee. And that is the only reason I had problems or I have pain. Well, that's not exactly how it works. You need a mechanically sound knee in order to move forward. However, there are other aspects to who we are, the mental and emotional aspects of who we are that play a role in the experience in your physical body. And when those things are kind of all over the place, they're not lined up, what ends up happening is, okay, I got to push through the pain. So mentally, you're like, I got to suck this up. It's not that bad. The pain's tolerable. So you go to the gym and you push through it. Now the knee pain's worse. So mentally, you're in one place. Emotionally, you're in another place because you fear the pain coming back. Physically, the pain comes back, and now what do I do? Because it's more frustrating, and you feel like, well, how's this ever going to end? So you double down on your efforts and you go to more physical therapy or exercise and things like that, and you continue to push through the pain. And it's a vicious cycle, and it spins you out, and over time, it bleeds out your will and your motivation. And as we get older, that tension in the joint squeezes out the synovial fluid in the joint, causes the joint to wear. You get diagnosed with arthritis. And the joint begins to wear more. And a long enough period of time with that pattern gets bone on bone. And that's usually when you're a perfect candidate for a knee replacement. The doctor will say, well, hang in there long enough. I'll give you a cortisone shot now, but eventually you're going to need a knee replacement. That's the story. That's the strategy. That's the game plan. That's the medical model. That's the medical model business strategy. That's what it is. And if you want to do that, that's cool. Like, I'm okay with it. It's been 22 years since my knee injury, 21 years since my surgery. And my knees are great. So if you're like good going down that path, hey, more power to you. However, if you want help, you want support, I got Knee Club. Head on over to thekneepainguru.com. Get involved in Knee Club. Let's see. It hurts more when I do those things. What did it say? Hurts more when I do those other things. So pain, I guess, is tolerable until I do those other things. Yeah. This all making sense? Questions, comments, nasty remarks? Make sure to give the video a thumbs up, like and subscribe to my channel. Turn on notifications for future videos. And yeah, join Knee Club. We got calls today. We got a call today at 1:30 p.m. Eastern time. You can get in there, start with the quick start guide, begin working with that. You can have questions. Email goes out to register for the call about an hour before. So that's 12:30 Eastern time is when the email goes out to register. And then the other call this week is Thursday at 5 p.m. And we do those every Monday and Thursday. And the resources are there. It's available if you want help. And, if you got questions, ask those in the comments section, and I'll cover those on future videos. Anyone? Okay. Well, Miss Miriam and Dee, thank you so much for all your questions and participation today. It was a great one. This is going to be on YouTube. It's also live streaming from the Knee Pain Guru website in the link that went out to my members this morning. I will also send out the replay for you to watch as well. Okay. Bill Paravano, the Knee Pain Guru, going to sign off for today. Have a wonderful day. I will see you on the next video.